let's talk about pathologies that you need to know for the OCE. So here's the thing, it's not a written exam. You don't have to give specific, you don't need to show your specific knowledge of the pathology by answering questions, so to speak, but you need to understand the pathology so you can explain your clinical reasoning for case 1 and case 2 on part 1 of the OCE. So you can learn about all the pathologies that you need to know on the blueprint that the College of Ontario Physios has released. Here's the thing. It's not that in-depth, okay? It's just like when you study pathologies on the written exam, you kind of need to go back and make sure you know pathologies that well. Now there's a few things that'll help you so that you can narrow down the content so the pathology information you're learning is specific to the OCE. We do this for you in the course, of course, which is really nice, but we're gonna give you an example here that shows you how we want you to learn pathologies for the OCE. Okay, so when you're studying pathologies, you are gonna make sure you know the answer to these 5 questions. So first off, what key information could be provided in the case study that makes you think they might have this pathology? Number 2, what key information do you need to gather during the subjective assessment? Number 3, what key information do you need to gather during the objective assessment? Number 4, what general approach should you take when you are providing treatment for a patient with this pathology? And number 5, what are safety considerations associated with this pathology? Good news, if you are in the OCE course, we've done this for you for every pathology. Woo woo. But I'm still gonna show you an example, and I'm gonna show you the example of pulmonary fibrosis, and we'll show you the classroom as we go through this so you could see what's included. What key information is related to pulmonary fibrosis? So the key information that you should know about pulmonary fibrosis include that it's a common type of interstitial lung disease. It is a parenchymal disorder where fibrosis and scarring of the lung tissues results in a loss of lung compliance. So the lungs are stiff and it's more difficult to expand the lungs to bring oxygen into the system. This is a restrictive lung disease. Risk factors include inhaling harmful particles, radiation therapy, and certain medications. Signs and symptoms of this disease include dyspnea, severe O2 desaturation, finger clubbing, dry, painful cough, rapid shallow breathing, fatigue, weight loss, and scarring and fibrotic tissue shown on CT. Okay, if the patient had pulmonary fibrosis, what subjective information would need to be gathered? Now here's the thing, we've done something pretty cool, and that's in the OCE classroom, we have one subjective exam no matter what the pathology is. So that's all you have to do is just stick to our subjective framework. Now what we've done in the classroom for all the pathologies that we review, we let you know if there's additional information that needs to be covered on top of what was in that subjective assessment. So in the case of pulmonary fibrosis, the question that we want you to include in addition to the subjective framework is, does the patient require any supplementary oxygenation? Okay, that's all you need to do. Stick to the framework and look in the classroom to see if there is any additional information you'd want to ask. If the patient had pulmonary fibrosis, what objective information would need to be gathered? Okay, so we talked about our frameworks for the subjective, but when we are doing our objective, we actually have broken it down a little. So we do have different objectives based off of what your primary issue is. So we have an MSK objective, we have a neuro objective, and we have a cardio-resp objective, okay? So you would just follow, in this case, the cardio-resp objective. You would then look in your pathologies to see, is there any additional objective information that needs to be gathered, okay? So in this case, the additional objective information that needs to be gathered would be assessing thoracic range of motion and measuring chest expansion. Now, I can't give everything away to you. These frameworks are a bit of our secret sauce. So if you want those, you'll have to log in to your OCE classroom.
Remember, when reviewing pathologies, we want to make sure we understand these 5 components. So let's move on to treatment.
All right, what is your approach to treatment for pulmonary fibrosis? So let's show you the classroom. The focus of physio treatment should include inspiratory muscle training. You want to focus on improving overall strength and muscles of breathing, which can help to optimize ventilation, lung volumes, as well as decrease the work of breathing. Your exercise should focus on posture as well as function. The goal is to maximize patient participation and independence without overexerting them. Your education should always have a role in PT treatment, and here the focus on education should be around energy conservation techniques, as well as stressing the importance of smoking cessation and potentially options for referrals if the patient wants help to stop smoking. Of course, this is irrelevant if the case doesn't state that they are smoking. What safety precautions should you be aware if the patient has pulmonary fibrosis? All right, in the classroom, we review this. So because of the restrictive lung disease, it's critical that we implement safety considerations when working with this population. In the case of a patient with pulmonary fibrosis, we must ensure that they exercise within safe limits and take extreme caution. We must monitor SpO2 to ensure adequate oxygenation during exercise and avoiding overexertion. We should also monitor for any changes in overall symptoms that could maybe indicate an infection, such as pneumonia. This would include monitoring for things like fever, malaise, and a productive cough with green sputum. Okay, you should now know how to prepare for pathologies on the OCE. So as a quick reminder, you're going to go over those 5 questions. So key information that's presented in the case, objective information and subjective information that you need to have, a general approach to treatment, and your safety considerations that you need to make sure you know. Okay? Again, we do this all for you in the OCE course. So I hope to see you in our course.